Have you ever felt like traditional medicine just doesn't get the whole picture? Like they're fixing the leaky pipe in your basement, but ignoring the fact that the whole house is on shaky ground? That's where the biopsychosocial model comes in, a revolutionary way of looking at health that could change everything. Picture your body as a magnificent but complex house. It has a solid foundation, your genetics, the wiring of your nervous system, the security system of your immune defenses. But that house doesn't exist in a vacuum. The weather inside, your thoughts, emotions, and stress levels has an enormous impact on whether things are running smoothly or a storm is brewing. And just like a house is influenced by its neighborhood, your health is deeply affected by things like your income, your family, the safety of where you live, and the support systems you have. Even past traumas can linger, leaving invisible scars that continue to cause problems long after the original danger is gone. The problem is, traditional medicine often focuses solely on the physical, the broken part that needs fixing. But imagine if every time your house had a problem, you only called the plumber, completely ignoring the electrician, the stress counselor, or the social worker who could help address the bigger issues. That's not a recipe for lasting well-being. The biopsychosocial model says, let's look at the whole picture. This means doctors understanding how poverty impacts health, therapists trained in the mind-body connection, and creating a healthcare system designed for true healing, not just patching you up when things fall apart. So, what does this actually look like in the real world? It means a back pain patient getting care for their injury, alongside learning stress management and getting help with a stressful job. A heart attack survivor being treated with medication and rehab, but also receiving counseling and community support to combat the isolation and depression that often follow. This approach empowers patients to be active partners in their own care. You are the expert on how your body house feels, what your mind is struggling with, and what challenges your life presents. When doctors and specialists truly listen and see you as more than just a set of symptoms, that's when treatment plans start making real sense. The biopsychosocial model holds the potential to transform our entire healthcare system, putting prevention front and center, creating teams of specialists that address all aspects of health, and building communities that support well-being instead of causing more sickness. It's a big change, and it won't happen overnight. But the exciting thing is, it's already starting. Doctors, clinics, and researchers are embracing this more holistic vision. And the more people like you understand the power of this model, the faster we'll build a healthcare system that's truly designed to help us thrive. If you want to learn more, click on the link in the description to get our book, The Body-Mind-World Connection, Rethinking Illness and Wellness. It's packed with in-depth information, practical tools, and inspiring stories of how this approach is changing lives.